Hello, beautiful people. Did you know that your brain needs oxygen and nutrients in order to function properly? And that this oxygen and nutrients are being transported to your brain through blood. Therefore, if this blood supply is being stopped or is being blocked by anything at all, your brain is not going to receive adequate supply of oxygen and nutrients that it needs to function properly. Ladies and gentlemen, you're welcome to Nurse Ika Show, and I am your host, Nurse Ika. And today, we will be looking at something that has affected many people around the world today. That is no other thing than cardiovascular accident or cardiovascular event or what we commonly call stroke. Now, just like heart attack, a stroke or a cardiovascular accident can be regarded as a brain attack. The blood in your circulation or in your system actually supplies your brain with enough oxygen and nutrients that it needs to function properly. If, for example, this oxygen supply is being cut off or is being blocked by anything at all, then your brain cells will be deprived of this oxygen and these nutrients that they need to function properly. When that occurs, you're going to suffer from what we call in the medical terminology, or you suffer from what we call in our medical language a cerebrovascular accident or a cerebrovascular event, what we normally call stroke. So like I said, a stroke it has the same phenomenon, or it occurs the same way someone can experience a heart attack. And in some of our videos, we have looked at the differences between a heart attack and a cardiac arrest. So we are just going to drop the link at the description so that you can always go to it and watch what a heart attack is all about. Now let us look at this stroke we are talking about. Many a times, or many people suffer from stroke. It could be a mini stroke without actually noticing that they have suffered from a stroke. For those of us who suffer from a cardiovascular accident, they actually can be two different types of cerebrovascular accident. Just stay till the end of this video and I'm going to explain to you these different types of cerebrovascular accidents, some of their signs and symptoms, and what you can do to help an individual who is experiencing a stroke. Now, if a blood vessel that supplies the brain cells is being blocked, maybe by a clot, if a clot blocks these blood vessels that supply your brain cells, then these brain cells will be deprived of oxygen and nutrients, and your brain is not going to function properly. So in that case, we are going to say that you are suffering from an ischemic stroke. Ischemic stroke simply because oxygen supply to the brain cells have been cut off. So that's why we say it's an ischemic stroke. Now, the next type, the two types I said, we have two types, the ischemic stroke and then we have the hemorrhagic stroke. Now, the second type, which is the hemorrhagic stroke, is simply when a blood vessel that supplies the brain actually ruptures. When the blood vessel ruptures, then the blood supply to the brain cells is also going to be cut off, and then you suffer from what we call a hemorrhagic stroke. So you're going to bleed in your brain. When you bleed into the brain, it's going to increase the pressure of the brain, so the brain cells are going to be deprived of oxygen and nutrients and they will die. Now, the earlier this is resolved, the better the chances of you to recover and the lesser the chances of you to develop a permanent brain damage. So if you see someone who is having signs and symptoms of a stroke, the earlier you report it and the faster they intervene, then the better the chances of this person to survive and the lesser the chances that they will suffer from a permanent brain damage. What are some of the signs and symptoms that you would see to determine that, okay, this person who is next to me is suffering from a stroke? The first thing is that you may notice that the person is having slurred speech. Slurred speech, for example, like I'm talking now, I'll not be able to talk. So if someone is experiencing a stroke, the slurred speech, they may have like, they can't talk, or so something like that is more of a slurred speech, and then you can realize that the person is having a face droop. So the face kind of, it's like the face is one-sided. One side of the face actually drops, so they call it a facial droop. So the person will have a facial droop. And then you can also realize that the victim may lose power on one side of the body or both sides of the body, depending on where they are having the attack. So another thing you may realize is that there may be dizziness, there may be loss of consciousness, and then the mnemonic, an easy mnemonic for you to be able to identify the symptoms of somebody who is experiencing a stroke is what I will call the FAST. F-A-S-T. Now, F, immediately you think, you have the impression that somebody is experiencing a stroke. You look at F, the face. Is there any facial drooping? So you're checking if the face is aligned. Are the eyes on the same plane? Both the different sides of the face, are they on the same plane? If it looks like one is dropping, then you may be thinking that they're actually experiencing a stroke. The next thing, the A, is going to be the arms. So in order for you to determine that they are losing power on one side of the body, you can ask them to raise their hand up. So if they cannot raise both hands, then they're experiencing a stroke. Many a times when you ask them to raise their hands, you see that they can raise maybe this side but not this side. So they are losing power on one side of the body. The next thing is the S. So are they having slurred speech? Like you're asking them questions, are they responding the way they normally talk, or they have slurred speech, like very slow in the way they talk? And the last thing is the time. You have to be able to note the time where it is occurring, and then because you will need that time of occurrence to report to the emergency team for prompt intervention. Now, we have looked at those symptoms to help us quickly identify that somebody is having a stroke. One thing I want you to remember, if you don't remember anything at all in this video, is that if you think that somebody is experiencing a stroke, do not attempt to give them anything at all to drink or to eat, because that will increase their chances of choking, and you don't want to have somebody who is already having a stroke and is choking. That may be a little bit complicated for you to manage. So don't give them anything to drink. Then don't administer any aspirin to that person at that point in time, because it is difficult for you to clinically just judge that somebody is having an ischemic or a hemorrhagic stroke. That's a stroke from a blockage or a stroke from bleeding. So because you cannot determine, do not give any aspirin to the person or any anti-inflammatory, because when you do that, assuming that it is a stroke caused by it is a hemorrhagic stroke, then the bleeding is going to increase and you will not be able to manage that bleeding in the brain. That may even fasten the person's rate of dying. So don't do that. Now, what will you do if you realize that somebody is choking? Of course, there is very little you can do, but what you need to do is that you first of all have to help that person, put them in a comfortable position. It could be the lying down position, it could, whichever position is the most comfortable position. You put them in that comfortable position, then you immediately call your emergency services in your location. Call them immediately to notify that this person is having a stroke, and then you reassure the person and wait and monitor their vital signs. I've shown us how to take our pulse. For example, you can always take the pulse here at the radial artery, or you can use the carotid pulse. So you just try to take the pulse and monitor the vital signs of this victim and wait for help to arrive. Then you reassure them while waiting. Now, when the emergency help arrives, you will have to provide them the time that the incident occurred. Remember that I said the first 3 hours when this happens gives you the best chances of recovery or the best chances of survival. So you don't want to jeopardize any time at all. So when the emergency services come in, you have to give them the time which it occurred. Now, I made mention of something which I said, the transient ischemic attack, or the The transient is ischemic attack, that's premature stroke. So if someone experiences a stroke, you realize that, okay, maybe you saw that there was facial droop, there was they lose power on one side of their body, there was slurred speech and all whatnot. Within 24 hours, even if they did not visit any hospital or any medical doctor or any medical services, the stroke resolved, they were back to normal, doing their activities. That is already a sign for you to make sure that they seek medical attention. Don't take it lightly, because when it hits very hard. So please, I hope that we have learned something about it, and we are going to pay more attention to those around us to be able to identify if at all they're having any symptoms of stroke and report them on time. Meanwhile, I want us to remember that one of the risk factors of someone to experience a stroke, there are many risk factors, but we're just going to mention a few, such as obesity. Due to our current lifestyles of today, many of us find ourselves above our normal body mass indexes. So obesity is a great risk factor for someone to experience a stroke. You can also have something like hypertension. Remember that hypertension is a slow killer. In our subsequent videos, I'm going to tell us more about hypertension and also about diabetes, so that we can know the hypoglycemia, how to manage these things. So you want to stay tuned on this Ika show to learn more on how you can manage your health. Remember that you are the best person who knows yourself and can better manage yourself. And please, if you notice any of these things, don't forget to run straight to the hospital so that you can be checked on and given prompt attention. Thank you so much for staying tuned. If you haven't subscribed, please do so. Don't forget to turn on your notification bell. Don't forget to like this video, to comment, and to share. I remain your favorite host, Nurse Ika, and this is Nurse Ika Show. Thank you. Bye-bye.